So if we look at dementia and cognitive impairment, those conditions are very common and they're increasing in frequency in older Canadians. Dementia is basically a decline in mental ability severe enough to interfere with daily life. So memory loss is an example. It is not a specific disease, so it describes a wide range of symptoms associated with a decline in memory or other thinking skills severe enough to reduce a person's ability to perform daily activity. Alzheimer's disease accounts for 60 to 80% of cases of dementia. It's only one cause of dementia. In terms of screening tools, there's several available. I've included one here that's called the AD8, and basically it looks at problems with cognitive function and how often those problems are being experienced. And the scoring is quite simple. Typically, patients should have a very low score. A higher score indicates that there's some cognitive impairment present. So what's the difference between dementia and normal aging? So some of the normal changes associated with our brain function as we get older become slower to process information. Hearing and vision can be affected, and the motor speed decreases. So reflexes, for instance, will decrease a little bit. Unlike dementia, though, those changes should not prevent normal day-to-day activities. Treatment of dementia, there's currently no cure for any type of dementia. Researchers are working hard on new treatments and ways to prevent dementia. For instance, they're looking at vaccines, new medications. We think that new treatments may be ready as soon as 5 to 10 years from now. So there's a lot of research going into treatments for dementia. Unfortunately, we don't have a great way of treating dementia currently. Some of the causes, of course, there's damage to brain cells. The damage interferes with the ability of brain cells to communicate with each other. When brain cells cannot communicate normally, it affects our thinking, our behavior, and our feelings. Some of the symptoms, so usually we say that at least two of the following core mental functions will be significantly impaired in patients with dementia. So things like memory, language, the ability to focus, reasoning, judgment, and visual perception will all be, or some of them will be affected by dementia. In terms of the dementia and cognitive impairment, incidence is very high. So we suspect that as many as 50% of people over the age of 80 will develop Alzheimer's disease. 5 to 8% of all people under 65 has some form of dementia. The number will double every 5 years beyond that age. So very common, especially, of course, as we get older. In Canada, currently, more than 500,000 Canadians are living with dementia. There's been an increase of 66%, an increase of 66% is predicted for the next 15 years. So as the population is getting older, especially the baby boomers, we expect that the incidence will dramatically increase. More than 65% of Canadians with dementia are women over the age of 65. The combined healthcare system and out-of-pocket caregiver cost totals an estimated $10 billion a year. So very significant. That's almost 1% of our national gross product. The cost for people with dementia are about 5.5 times greater than for those who do not have the disease. So it's very expensive to take care of people that suffer from dementia. Up to 75% of family caregivers will develop psychological illness, and 15 to 32% will suffer from depression. So being a caregiver is very stressful. With more stress, of course, the risk of depression will increase. Global impact. So as of 2015, 47.5 million people worldwide, more than the total population of Canada, are living with dementia. So very common throughout the world. It's not a problem that's unique to Canadians. The global number will increase to an estimated 75 million by 2030 and will almost triple by 2050 to 135 million. So that's why dementia is an area where a lot of research is being done, because the problem is growing in amplitude. Total healthcare costs for people with dementia amount to more than 1% of the global gross domestic product, or over $600 billion in 2010. So very, very expensive. Living with dementia, so planning for the future is key, right? Involve family and close friends and explain the diagnosis. It's important to understand that the person's cognitive abilities, including memory, will decrease and more help will be needed over time. Important to plan for the future while the person can still talk about what they prefer, so living arrangements or healthcare decisions. It's important to have a substitute decision maker, someone that will be able to make decisions once the patient's unable to do so for themselves. And then advanced directives, so medical preferences. Finances, also important to plan. So understand their financial situation and have someone that can make financial decisions once the patient can no longer do that. Eventually, people with dementia will not be able to drive, and so it's important to plan for transport early. It becomes difficult for people, right? So if they don't have a car, they risk being more socially isolated. You don't want to take away license solely based on memory, but based on function. So are they able to physically drive a car, basically? Wandering is another problem with dementia. So those patients tend to get lost. They can get lost, fall, and so close supervision is often going to be needed. Maintaining contact can also be useful, so things like GPS locators or cell phones can be useful. In terms of natural treatments for dementia, vitamin D is one of the key ones, and an international research team conducted a study that looked over outcomes for more than 1,600 seniors over 6 years. They found that those who were severely deficient in vitamin D were more than twice as likely to end up with Alzheimer's and dementia. Participants who were only mildly deficient had an increased risk by almost 50%, by more than 50%, while those who were severely deficient had a 125% increased risk of eventually developing dementia. So in terms of preventing the issue, vitamin D, really, really important. Ginkgo is often used because it helps to improve blood flow in small blood vessels, especially in the brain. So ginkgo often used for memory for that reason. Ginkgo may benefit people with dementia and may be as helpful as some of the drugs currently used for the treatment of dementia. Well-designed research is needed. The dosage, so in terms of how much is typically recommended, so usually we'll look at 240 milligrams as low as 120 milligrams of ginkgo per day for those that are trying to improve cognition. Bacopa is another plant extract that's often used in traditional Ayurvedic medicine in terms of memory. And so Bacopa can be useful just like ginkgo for patients with dementia. So it helps to improve cognition, basically. It inhibits acetylcholinesterase and might increase acetylcholine levels, which is basically what current medications do for Alzheimer's or dementia patients. Dosage is typically between 50 and 150 milligrams 2 to 3 times a day.